Hi there. I wanted to talk to you a little bit more about this pain, and hopefully you saw some of the other videos. I have videos on that explain what pain is, give a distinction between chronic pain versus acute pain. And what we're going to do with this is a part three. We're going to be looking at persistent pain. And that persistent pain is that continual, nagging, aching pain that you just have trouble getting rid of. And a lot of times people just don't understand what it is that's contributing to the persistent pain. And so we're going to address a few factors about this. And hopefully you'll take away something that's going to help you to be more optimistic about what you can do. But I want to give you a little bit of kind of background physiology because I think it's very important. Again, you hang around with me long enough, I like to explain how the body works. But when you're dealing with any kind of sensations, we're dealing with your nervous system. And there are two main components, two main nervous systems that are going to be associated with pain as we're going to talk about it today. And one part of that nervous system is your peripheral nervous system. And basically, those are all the nerves that are in your trunk of your body, in your legs, and in your arms. And that is connected to your spinal cord and your brain, which make up your central nervous system. So we have a peripheral nervous system, a PNS, and we have a central nervous system, CNS. Now, we're talking about 43 miles worth of nerves. Now, this is a lot of nerve highway, a huge nerve highway. And these nerves are what track your sensation, they track your balance, they track your temperature, pressure, movement, and when it comes to what we're talking about, any kind of damage. And so when you're dealing with your nervous system, the basic explanation is that when you put yourself in a position of potential harm and damage, or you are getting harmed and damaged, like the picture shows here, your nerves in your hand, as it's getting too close to the hot fire, you have sensory nerves that are going to tell you to pull that hand away. That is just a natural reaction. And as a way of protecting you, you're going to get signals from the peripheral nerves that are in your hand that are going to travel up in milliseconds to your spinal cord. It's going to go up to your brain. It's going to come back and it's going to tell you that, oh, you are in danger. You are in a bad position and move your hand away. And so this is how your central nervous system and your peripheral nervous system communicate with each other. Okay, so when you're looking at dealing with a problem with injury, okay, it's the same thing. Something has happened and you're injured and your body is wanting to protect itself. So it's going to make you either stop a movement, move away from something. And it's a way of, again, the brain has gotten a signal that something is wrong. And so that's part of the pattern of communication. Now, the normal course of injury is that you have an activating event. So that will be something like an injury, like we said, or it can be a surgery. And then the brain is notified, makes you move away from that danger and pain. And but then what you're supposed to go into is an inflammatory stage, and that's a inflammatory stage of repair. It's starting the process of cleaning up the debris from the damage that's been done. And then what most people don't realize is that there are actually more than one stages when it comes to your inflammatory process. And we get stuck on the inflammatory process, but there's actually an anti-inflammatory stage of recovery. So there's an inflammatory stage of your recovery, which is the first portion of it, and the anti-inflammatory stage of recovery. And people are getting stuck in that first stage. And so what's supposed to happen is after the body has done the warning, moved you out of the way, started to clean up debris, so to speak, and brought in those white blood cells, you are supposed to move to this next phase of recovery. And then after that, then your body will start to do some remodeling and some restoring. So that's your normal course. Again, whether it's an injury or whether it's a surgery, these are the stages that you're supposed to go through. And all of these should be finished within a 3 to 6 month time period. Now, the 6 months, if you looked at the other video, that's if you're dealing with something that is severely traumatic. you've had a major surgery, you've had tissues that have been removed, replaced. It can take you some time depending on what condition you were in before this surgery or the injury. So what we're going to look at briefly is, why does pain persist? Because that's usually what is causing people the problem when we look at those 50 million people who are in chronic pain in the United States. And so what's happening is that the electrical communication, that communication we talked about when it comes to your body registers that something is a threat, that electrical communication is not getting cut off. So your peripheral nervous system and your central nervous system are continuing to communicate, and it's not getting the shut off valve turned on this process. So then that's why you're still feeling the pain. But then it's okay, that's happening. I have had a procedure done, and a year later, even 2 years later, I've had my joint replaced and I'm still hurting. So why am I still hurting? Or I've had an injury at work, and why am I still hurting? It's been the length of time that you're telling me, but I'm still having pain. And so then I think that's a very valid question, because that is exactly why people are having chronic pain. Now, if you looked at my previous explanation about chronic pain, you're going to understand that there are some factors that have to do with what's happening in the brain. And we talked briefly about that, and as far as where your pain centers are after a while. But I want to also look at some other factors that can be contributing to your persistent pain. And two, just to keep it very simple, there are physical factors and there are emotional factors. And we're going to be talking about a few of the physical factors. This is not exhaustive, but it's just enough for you to really start thinking about what could be the problem with you. So observations that I've made, and I'm trying to keep it simple, is that the bottom line is that, to me, from what I've observed, tissues themselves have not fully recovered as being a big part of why people have persistent pain. Now, fully recovered, what does that mean? Fully recovered can be hard to say, okay, then I'm not healed, Adina, because if you've had a joint replacement, especially, or some kind of surgery, and you're going back and they're taking your scan, they're looking at the x-ray, everything is intact, and that's what happens. Everything looks good. Don't know why you're still hurting. There's much more going on, and that still tells me that yes, maybe the components of your joint has been replaced. Yes, certain procedures have been done, or yes, you've gone through certain interventions, but the tissues have not fully recovered. And we have to understand that this is part of the persisting pain, because there is some continued inflammation or swelling that can be taking place. Now, the swelling doesn't have to be this full copious amount of fully engorged area. You can have a low level of swelling and inflammation that is staying within that tissue. Now, why, though, is this happening? Typically, it's because of what you're taking into the body. And if you're eating things that are inflammatory to a tissue, it's going to continue to create that cytokine storm that people hear about. And that inflammation process of the recovery does not switch off, because you don't have things in your diet like omega-3 fatty acids, which is literally what is part of the anti-inflammatory recovery phase starting. Okay, so that will definitely continue to perpetuate pain. Then also, if you're sedentary, and a lot of people think it's better just to rest something. And I even had a patient tell me recently that's what they did after they had injured themselves, and they did that when they were in their 50s. And then I had to explain that it doesn't work, and actually it wasn't a good idea then. Lack of activity leads to problems either immediately, depending on the kind of activity you put on top of that area that's been injured or had surgery, but you also have the lack of activity that is just plain old, I'm protecting it, I'm not going to do anything until it heals up. And then what's happening is those tissues are going to start to be changing, and we're going to talk about how they could be changing. So that lack of activity is going to be affecting your circulation. So with your circulation problem, you are not getting good blood flow to this tissue. And like we already talked about, poor diet can contribute to this and its inactivity. But what this does, it creates a condition of stagnation. And I really want people to understand that when you're hurting and you're feeling, and we're going to talk about sensations and pain, but when you're hurting and you're feeling like you can't get past these pain problems, you are likely not getting good blood flow. And if you're not getting good blood flow, then all of those chemicals that are part of the repair process, or part of all of the chemicals that might be part of the lactic acid, it's just going to sit there and sit there. And so you're going to have persistent pain because you're not clearing out the tissue. You have to have good, perfect circulation if you want pain-free tissues. And when a person is not active, when a person has been guarded and they're not moving a part of their body, when a person is continuing with, like I said, a poor diet, because there's certain foods, and we'll talk about this at some point, but there are foods that create we call it vasoconstriction, that it actually makes the vessels of the blood vessels constrict and not allow good blood flow. And I'll have to tell you right off the back is going to be things that are high fat diets. It's going to be things that are high sugary foods. Those things are inflammatory and those things inhibit your blood flow. And if you don't have good blood flow into the tissues, you're going to consistently hurt. Okay. Now that's going to continue to create a problem, which basically is weak tissues. Weak tissue is going to come from not being used. Weak tissue is going to come from not getting good blood flow. Okay. And again, not getting proper nutrition. And so when you have weak tissue, this is the big picture, guys. If your tissues are weak, they're not going to be able to perform postures to keep you standing and doing things. It's not going to be able to perform posturing to allow you to stabilize yourself so you can move about, whether it's literally moving items, whether it's lifting anything. And it's important to understand that if you're weak, let's say at your core, you're going to have problems with your extremity work. Okay. If you're even weak at your extremities and you can't seem to build up, you likely have problems with your weakness in your core. So the longer that you have allowed an area in your body to stay in pain, you are basically getting weaker and weaker. And it gets staggering to people because they feel like, operate, I'm walking, I'm moving about, and I'm able to do things, but they're doing this on top of weak tissue. And so these are going to be contributors to a persistent chronic pain problem. Okay, so then you're like, okay, Dina, I've done everything I'm supposed to do. I've had my injuries not getting better. I've gone to physical therapy. I've gone to a chiropractor and I've done all the right things, but I'm still hurting. Then I have to tell you that you are still not as strong as and flexible as you really should be. And again, this is something that is a big problem when, even worse, when someone has done nothing. They've done nothing but take a pain pill. And again, like the gentleman that I was just talking to, this injury to the shoulder happened when he was in his 50s. He's now in his 80s. And what is happening is things are bad enough at the point now where if he is missing his therapy and he doesn't do his exercises, he totally loses his strength in the shoulder. And it's been really wild to watch. What's nice is that he can build it back up again. We can get him going when he gets back in town. But I've explained, you have to be proactive and you have to do things consistently if you're going to break this cycle. So if you've been hurting, okay, I know it's hard, but I'm going to encourage you. So, Dina, what do I do to get out of this persistent pain? You have to start breaking the cycle of stiffness by taking steady steps. You're going to have to empower your body to heal by doing movement. Okay. You have to trust your intuition. Okay. And honor what your body can handle, but you have to embrace motion as medicine. It is so critical. And I know that feels counterintuitive, but I will tell you, unless you are going to go try to 50 pounds, or if you're trying to push something that is not wanting to move, refrigerator or so, you're really not going to do anything to damage yourself by moving. Now, there are certain back issues that you have to be careful which direction you move your body. But overall, guys, you've got to start moving. And I tell people, just be natural with it. And the very thing, the very motion that you don't want to do, that's what you're going to start doing. You take a deep breath and you just start moving into that motion just gently, and do not allow yourself to be stopped by that pain that even seems to want to take your breath away. If you breathe into it, you're getting oxygenation, which is going to help you with the blood getting nutrition and getting more oxygen to the tissue and improving that circulation. And that's going to start decreasing your pain levels. So movement is critical. And it's just not just about exercise, guys. It's about regaining control and confidence in your body's ability as again. You want to be the one that's dictating what your body does and not the other way around. So these are some tips for persistent chronic pain. Also, when you are stronger, you're going to be having less hurting. And so you want to perform strength training type things. You see the kettlebells here? These are wonderful. And you want to start using iron. You want to start using resistance bands. And I would say like power band type things. You're beyond tubing. Okay. You've got to use things that are going to make you strong. Now, I understand you're going to need a little guidance as to how to do this. But I want you to know that there are things that can be done, and you are not going to damage yourself unless you just go hog wild and do 25, 30 repetitions when you've not even done one or two. Be reasonable. Now, if you need more guidance, then it's definitely important for you to start talking to a therapist who can give you some more specific guidance. Okay. But when you are looking at getting your recovery on track, a body in motion writes the opening act of initiating your recovery story. You have to be the one in charge. And medication is not going to help you with this. Putting heat pads on all the time is not going to help you with this. It's motion. Your motion is going to be key. And so we're going to talk a little bit more about what it means for you to deal with pain with other factors, but I really want to encourage you to start moving. And so if you're really feeling okay, I really don't know what to do. I'm scared to move, or I've been to therapy, and I will tell you, and this does happen because let's be fair. Insurance dictates a lot of things, guys. And so when we're dealing with an injury and recovery, especially if you're someone in the Medicare age, you can actually end up having to stop it before you're really ready to do the things that you really like to do. And when you're finishing your therapy, you have just gotten like the beginnings of your exercise program. And what needs to happen is you have to progress. So you can go through therapy, but if all you've done when the therapy has gotten to the point where you can kick a few weights up in the air, or you can lift your legs out to the side or back behind you, or even do a few little squats, that is just the beginning. You have to build on that. You've got to start adding more resistance. You've got to make it more challenging so that your body can keep up the power building and keep those tissues in good condition so that they don't start faltering. And again, it's the weakness in the tissue. It's in flexibility too. Stretching is important, but a lot of it is we've got to get you strong. And so again, if you need some guidance in that, go to my website, and I'm going to leave that in the frame. That's going to be www.restoredhealthsolutions. It's restored-healthsolutions.com. There's a place there for you to set up a 15-minute consultation, but also just feel free. You can contact me through the website, and I will be very glad to answer some questions and then just try to see when we can get you going. So we'll set up an appointment. Just email me through the website, send a message, and then we can go from there. But I do want you to know that you can get better. You can get rid of this persistent pain. And we're going to talk in another video about how do I define pain? Because I asked that question and people, they just say it hurts. No, you got to be specific. So we're going to have a video about that as well. But hopefully you have found this helpful and encouraging. I know it's just a start, but it's something to let you know that you can start feeling better. Thank you.